Okay, so if you have been following me, you know that I was diagnosed with breast cancer March 31st of this year, 2023. I'm 51 years old, and my initial treatment was 8 rounds of chemotherapy every 2 weeks for 16 weeks. So that was for 4 months. I finished my last round of chemotherapy on August 3rd of this year, 2023. And then I proceeded to have a double mastectomy on September 5th of this year, 2023. So all of that has taken place, and I'm in pretty good spirits. I didn't go flat. I do have tissue expanders in now, and I will be having reconstructive surgery. So I'll tell you guys, when I first was diagnosed and um, realized the situation, I just really thought I would document my journey a little bit more, be positive, be uplifting, encouraging to any ladies that had been diagnosed, or if you had any friends and family that were diagnosed. But I will tell you, this has really taken a toll on my mental capacity. You know, my mental health, more than anything, has taken a toll. Feeling really down, feeling really ugly most days. I personally, this is just my story, feeling like it had taken my womanhood with no hair, no eyebrows, no eyelashes, and lastly, my breasts. Some days I woke up and I really didn't know who I was when I looked in the mirror. I didn't want to get dressed. I didn't want to go anywhere. My husband was still taking me on dates, but I refused to take pictures. My spirit was completely demolished, and I didn't think counseling would help, because what can they do? You're not going to convince me that I look pretty. I don't care how many people tell me that. My sister tells me that every single day. My husband tells me that. I personally I really felt like feel like just a monster. Um, because I just felt like I always was pretty my whole life. I dressed nice, and it was discouraging, going out the house and it was hot. Should I wear a wig? Should I go bald? Simple, but not. So again, I was committed to documenting once a week, letting you know how the process was going with the chemo and things like that. And one thing I do want to mention is, I don't think people realize that the chemo treatments or the infusions are not really the worst part, at least for me, of my treatments. I've had the effects of chemo that have been terrible. The fatigue, the bone pain, the neuropathy, my fingers discolored, my feet discolored. Um, just getting a little better, but like currently I can't even feel my fingers for the most part. My feet have gotten better, but all of that takes place after you've stopped chemotherapy. Most days I can't even take 10 steps without being completely tired. It takes me 2 to 3 hours to get dressed. I'll have to shower, then take a break. Some days I even need help with the shower chair. Um, Take a break. If I'm going to wear a wig, trying to get that together. If I'm doing my makeup, that's going to take another hour. Every process, is going to take me 20 to 30 minutes, because I will always have to take a break in between. So if I know I'm going somewhere and I'm getting dressed, then, I really have to plan for it. Even if it's taking a nap, making sure I take my pain medicine so I can get through the afternoon or evening or whatever the event is. So even after you're done with chemo, it's a very long process. And let me add a disclaimer before I continue on with my journey so far. I just want to say I have had a tremendous amount of support, encouragement on a daily, weekly basis, um, with all of my friends and family, a tremendous amount of support, and that makes a big difference. But sometimes when you're going through something, even with that support, even with that encouragement, you can't talk yourself out of the negativity sometimes. I have worked through my treatments. I took off some time after my surgery, and in a few months I'll have my reconstructive surgery. um nothing can compare can what am I trying to say? Nothing can uh prepare you. Nothing can prepare you for how your chest looks after the mastectomy. Like I said, I do have tissue expanders, but mine weren't completely full because I didn't have large breasts to begin with. So the tissue expanders are so that my skin, they can stretch my skin for either the implants or the deep flap surgery. And I'll talk about those two options later because I don't want to make this very lengthy. Um, but that's to prepare my skin to stretch. And I also had some lymph nodes removed, and that was the most painful part of the process, right underneath my right arm where my tumor was. They just want to make sure that the So, just to summarize, I was diagnosed with breast cancer on March 31st of this year. I do not remember the date I started my chemotherapy. I apologize. But I had 8 rounds of chemotherapy, which was a total of 16 weeks because it was every 2 weeks. And my last chemo treatment was on August 3rd. I had a double mastectomy on September 5th. And when I did that, they, of course, took my entire breast, both breasts, as well as 3 lymph nodes for my surgical oncologist to do a pathology report to make sure that none of the cancer has spread to my lymph nodes or any other areas of my breast. So the reason why I wasn't able to get either implants or the deep flap surgery immediately is because we have to wait for the pathology report. Once that pathology report comes in and I'm clear, then I can proceed in a few months for either the deep flap surgery or implants. But I still need to keep the tissue expanders in for a few months again to stretch my skin. If for some reason the cancer has spread, then I will need to receive at least radiation. I don't know the treatment plan, but my surgical oncologist, that's what she's telling me, that if it's in my lymph nodes or it's spread to other areas of my breast outside of the one tumor that I had, I definitely will need to get radiation before the reconstructive surgery. And she says she's about 95% sure that it didn't, but they just have to make certain because they don't want to do all that surgery and then have to go back for treatment. And you guys can definitely go on Google or YouTube and look up tissue expanders and see how that process works. I will post a video in a couple of days explaining deep flap surgery, implants, and how the reconstruction process works. If I was able to keep my nipples, nipple sparing surgery, all of those things like that. But today I just wanted to do a quick update because I know I really hadn't documented through the entire journey. It's really been a struggle for me mentally, and I appreciate all my friends and family for sticking with me, bearing with me, not answering phone calls maybe as much or text messages as much. I greatly appreciate you, and I love you for that. So again, my next process, I will be having 2 more surgeries soon. Once you're diagnosed with cancer, whatever type of cancer, of course, I have breast cancer. You have an entire team, and my plastic surgeon is thinking along the lines of March or April that I'll be able to get my reconstructive surgery done. But again, that it has to do with the pathology report, his schedule with surgery and things like that. And for the time being, I'm dealing with this. Now, I'm really not in too much physical pain, except underneath my arm where they took my lymph nodes out. It's more of emotional and mental, just not feeling my best, to be honest. I just want to be honest. I don't want to be a Debbie Downer, but I just don't feel like Lori right now. But thank you guys, and I'll check in soon.